Hi, I'm Ron Miller. My law firm handles birth injury malpractice cases, not only in Maryland, but across the country. In this video, I'm going to talk about fetal macrosomia and how the failure to diagnose macrosomia in advance can result in serious birth injuries. So what is fetal macrosomia? Fetal macrosomia is a condition that occurs during pregnancy when the baby becomes abnormally large. It's as simple as that. A baby weighing over 9 pounds at birth is considered macrosomic. A fetus gets bigger over time, so prolonging a pregnancy increases the risk of fetal macrosomia and fetal birth weight. Macrosomia is a potentially dangerous condition that automatically creates a high-risk pregnancy. Fetal macrosomia in large for gestational age babies carries greater risk of shoulder dystocia and other complications. The reason for this is fairly simple. When the baby is overly large, it is much more difficult to pass through the small birth canal, making a normal vaginal delivery very problematic. If the baby is too big, it can get stuck in the birth canal during delivery. Now, no one is suggesting that medical malpractice causes fetal macrosomia. Usually the cause is genetic. The issue is how doctors diagnose and treat fetal macrosomia. So what doctors have to do is accurately measure and estimate fetal weight during the pregnancy. Advanced diagnosis of fetal macrosomia is critical to avoiding dangers to both the baby and the mother. If doctors diagnose macrosomia in advance, they can avoid any dangers by scheduling a preemptive C-section. The American College of Gynecologists guidelines state that prophylactic C-section may be considered for suspected fetal macrosomia with an estimated fetal weights of more than 5,000 grams in pregnant women without diabetes and more than 4,500 grams in pregnant women with diabetes. A lot of defense lawyers try to make those words "may be considered" do a lot of work in cases where it's clear that the doctors could have prevented a birth injury to the child by just performing a C-section. The reality is that 10% of babies have macrosomia. So doctors and nurses do not always have their guard up to prevent a disaster. So most of the birth injury cases involving macrosomia involve a delay in diagnosis or treatment. Often the solution is just simply perform a C-section. The attorneys at Miller and Zoyce handle birth injury cases. We are very familiar with malpractice claims related to the failure to diagnose and treat fetal macrosomia. If you delivered a baby with birth injuries resulting from a doctor's failure to diagnose fetal macrosomia, you and your child may be entitled to compensation. Call us at 800-553-8082. Thank you.